Hello, everyone. Welcome to National Patient Advocate Foundation's webinar. We will just give everyone just a quick moment to file in. We have a number of interested guests today, and we have 4 lovely speakers who will talk us through a very lively discussion. So just give it about 30 more seconds, and we'll go ahead and get started. Okay, I think that should do it. All right, well, again, everyone, welcome to our webinar, Unifying the Field, Navigating Patients to Financial and Social Supports. My name is Nicole Braccio, and I am the Policy Director at National Patient Advocate Foundation. This webinar is the first in a 2-part series that's focused on the common thread that unites the diverse navigation field. The series is part of NPAF's Health Needs Navigation campaign, which aims to advance interventions that address the most pressing needs described by patients of all ages and their families. We'll go ahead and go through some housekeeping items, but I did also want to thank the Association of Community Cancer Centers for partnering with us on this webinar. And as far as housekeeping, this is a Zoom meeting format. So we ask you all to please mute your lines when you're not speaking. We invite you to turn on your cameras if you'd like. And at the end of our panel discussion, we will have time for questions and answers. But if you have any burning questions, you can enter them in the chat at any time. And one of our team members at NPAF will can read out your question, or if you prefer, you may turn on your camera and raise your hands. There should be an option at the bottom of your screen to raise hand, and you can unmute yourself and ask your question or comment. And then finally, we have a very quick evaluation at the end of the presentation. We would really appreciate if you can fill that out so we can continue to make excellent webinars. All right, so just to get started, we wanted to ask you all to share just your introduction, give your name and your location, city and state. You can enter that in the chat. And our panelists should also be able to see who is here. You know, I think this is always helpful to see. We have a number of patient advocates and patients and caregivers in addition to navigators in the field in the room. So it's great to see where you all are coming from. And great, we have lots of people from all corners of the country. Right, and keep that coming. And then I think, you know, on behalf of my whole team, we are super grateful and thrilled that you all are here today. We have 100 people in the room here. And I'd like to start out with this beautiful word cloud that my colleague Melissa Williams made. NPAF, for the last couple of years, we've been doing our due diligence and trying to understand who are the navigators in the field, what are the needs that patients and families say are the most pressing top concerns, so that we can make sure as a collective field we're addressing that. NPAF is the advocacy affiliate to Patient Advocate Foundation, so we are first and foremost inspired by the PAF navigators who are providing direct assistance to patients across the country by phone for 25+ years. So when we started this initiative, our Health Needs Navigation campaign, we identified through an environmental scan what are the various roles and services that navigators provide. And as you can see, there's a number of terms and titles and roles and responsibilities here. So we have our first polling question for the audience that my colleague will launch in just a moment. But, you know, look at this word cloud and tell us, you know, regardless of where you're coming from, do you see yourself captured here? whether it's something that you do within your role or something that you need as a patient or caregiver. So that poll just launched. Great. Give it just a couple of seconds for folks to answer. Do you see yourself captured here? Yes, no, or not sure? Right, we have over 60% of people participated, and we have a resounding yes. So that is very reassuring to hear, and a major reason why we wanted to have this webinar. So we can unify the field from a patient-driven perspective, given the 25 plus years that Patient Advocate Foundation and National Patient Advocate Foundation has in advocating on behalf of patients and learning from you all in your communities about what are your most pressing needs. The next poll question we have, we want to know, what role are you representing today? So we'll launch that. Just a few options to choose from. Number 2, what role are you representing today? Okay. Perfect. I think we are at a quorum there. So about 54% of you are a navigator in the field, such as a social worker, patient navigator, community health worker. About 14% are patients and or caregivers. 21% of you are coming from a patient advocacy organization, and 11% other. Excellent. Well, it's great to have you all here. Moving on, I think one thing that grounds the entire room here is the fact that regardless of the type of health condition you have, or regardless of the health condition that you help patients and families contend with, financial distress is a top concern for many. We conducted some research in 2019 around financial distress and top concerns around goals of care and dealing with the health condition. And out of over 2,000 patients who responded to the survey, the number one concern was the overall financial cost of treatment. And this actually exceeded the possibility of dying. Additionally, people pointed out, long and short-term side effects of treatments were concerns, but again, financial cost of treatment was the number one concern. I think it's important to note this because we all come from various backgrounds, but oftentimes the help and the assistance that we provide patients, or that we as patients receive, has to do with financial assistance, financial planning, all of this to avoid financial distress. And I'll just share a quick note that my own father, when he was nearing the end of his life, the number one concern he had was trying to avoid medical bills piling up and medical debt and being a financial burden to the family. He was more concerned with that than anything else. And just another reason why this is such a poignant and passionate project for me and my family. But the good news is there is a proven solution. I'll just talk through this diagram for a quick moment, but we all know when a patient or caregiver is diagnosed with the health condition, there is a number of factors that they're considering. Often if it's a complex and serious condition, first they're contending with treatment decisions around, what medications or treatments should be pursued. That comes with direct medical costs and questions about clinical goals, symptoms, and side effects. But in addition to all of that, and what's not often talked about in the healthcare setting, is how will I make it work? As a person with my day-to-day life, how will I, through treatment, get to my appointments? How will this impact my work? what do I do about my children and housing situations, whether it is related to any of these issues. These are all things that are often happening in the back of people's minds, but are not always brought up during medical appointments or in the healthcare setting. And certainly these concerns are compounded when you have underserved populations or limited resourced groups who are already contending with health disparities and the effects of the social determinants of health. But needs navigation support, and we use this term, broadly to include all of the things that many of you on this call do in your roles through financial care planning, financial advocacy, billing assistance, all of these other items. These are all informed by a needs assessment or screening for patients, as well as communication about what is available to them and resource coordination to connect patients to and through whatever supports may be available to them, financial or social supports specifically. And we also know that people want what navigation provides. We did a survey recently in the spring of 2022, asking patients when we described what needs navigation services was. And again, that's all of the financial and social supports related to a health condition that I mentioned in the previous slide. 1 in 3 people had no knowledge about the availability of needs navigation services in whatever form that took. But 3 in 4 people felt that skilled needs navigation services were very important as part of their care. And this number was above 95% when considering whether navigation services are important at all. But 75% said they were very important as part of their care. So we know people want this information and want access to these services in a reliable, consistent way that's part of the standard of care. And so with that, we have a fantastic panel lined up for you today. 4 experts in the field, both from a on the ground as well as a bigger picture perspective. I'll just briefly introduce them and they will give a little bit more in their own introductions. But first we have Karen Harwood from Palm Beach County Medical Society Services. We have Jordan Karwedzki, financial counselor from Green Bay Oncology, representing ACCC. Ashton Nesmith-Kuchera, a board certified patient advocate and rockstar NPAF volunteer. And Michelle Proser, the senior director at the Financial Health Network. And so with that, I will stop sharing my screen and we will go ahead and get started with the panel. I think we can go in that order. Karen, if you'd like to start first and introduce yourself.
Sure. My name is Karen Harwood. I'm a social worker at heart, and I've been working in Palm Beach County for close to 30 years, helping patients access care. I've worked in home health settings, I've worked in hospice settings, I've worked in nonprofit settings, and now I work in the free clinic setting where I help patients that are uninsured access care through several different programs. I'm also very involved on a state level with the Community Health Worker Coalition, and we do quite a bit of work with training community health workers here in Florida.
Thanks, Karen.
Thank you for this opportunity.
Absolutely. Jordan, do you want to go next?
Hi, everyone. I am Jordan Karwedzki. I am a financial counselor at Green Bay Oncology in Green Bay, Wisconsin. I have been in oncology for about 13 and a half years now, and the vast majority of that time has been as a financial counselor. So I've seen a lot of changes in insurance coverage and what is required for assistance and authorizations. In our cancer centers, we work with both medical oncology and radiation oncology. We also assist in gynecologic oncology and pediatric oncology as well. So pretty much anything our providers are ordering for patients, from IV and oral chemotherapy to radiation, scans, procedures, labs, just regular old prescription medications, we are making sure that's covered by insurance, taking care of authorizations on them, and then also assisting the patients find assistance to be able to afford their care, whether that's through foundations like Patient Advocate Foundation or through drug companies. Anything we can do to help them out, get them set up with resources to help with maximizing their insurance coverage. We also work with very closely with our social workers to make sure that we're taking care of them from all sides. As mentioned, I'm also a member of ACCC. I'm a member of their financial advocacy network on their advisory committee board. I'm also a member of their networking task force, bringing together financial counselors, advocates, navigators from across the country, connecting them, working together as a resource for everyone, putting together guidelines and training tools, education pieces, getting voices out to the government on the big sticking points for patients with cancer and what they need help with.
Thank you, Jordan. That is quite a number of activities that you do. So we thank you for being here. Ashton, why don't you go next? Oh, and you were on mute.
Sorry. Hello, everyone. Good afternoon. My name is Ashton Nesmith Kochera. I'm a board certified patient advocate and have an independent practice specializing in chronic illness. Most of my patients I work with are neurodiverse and have complex needs while navigating the healthcare system. I have taken part in many patient advocacy initiatives and volunteer for National Patient Advocate Foundation. I'm also on an SDOH committee for Patient Advocate Foundation and PCORI. The services I offer are typically for patients with complex needs. They come to me after their family and friends that may be helping them or care partners are typically overwhelmed. Information overload is a very real thing. And it's not as much as they have financial issues, as much as they need navigation to get a correct diagnosis and treatment.
Okay, and I'm also being cognizant of acronyms. So Ashton, you mentioned SDOH, that's Social Determinants of Health for anyone on the line who needs that. And PCORI is the Patient-Centered Outcomes Research Institute. So thank you for sharing that. Michelle?
Hi, I am Michelle Proser. I am the Senior Director at the Healthcare Solutions at the Financial Health Network. We are a nonprofit and our mission is to improve financial health or financial wellness for all, with a special focus on those who struggle most or those who may not have the same level of inclusion in the financial health system. And we know from our own research and experience that financial health is more than one's income. Financial health comes about when your financial systems work for you and help you meet your current financial obligations and needs, helps you absorb and recover from unexpected financial shocks, improve your financial situations over time, and overall help you build resilience, pursue opportunities like education, help you build wealth and thrive in the long term. And we believe that healthcare plays a role in the financial ecosystem that allows someone to be financially healthy. And so in my role, I work in bridging sectors, the financial world, as well as the healthcare world. And for example, we work with healthcare to prevent it from disrupting financial health, looking at medical debt as a good use case of that. And we work directly with healthcare to help them develop and implement solutions that more proactively improve people's financial well-being. And prior to being at the Financial Health Network, I've been here about a year now, I was with the National Association of Community Health Centers, working with community, migrant, homeless, and public housing health centers, doing research and some policy research. Also working on data strategies as well as social risk screening. And so we spent a lot of time thinking about what is the right diverse care team that is needed, what data sources are important, and what are the infrastructure and policy changes that really allow people to improve health and health equity.
Thank you, Michelle. So I think we certainly have a breadth and depth of expertise and knowledge here from various angles. And I think my first question to our panelists, you talked a little bit about what you do in your current role, and some of you mentioned, who you work with and who you refer patients to if you are not able to, completely assist them with all of their needs. But I'm wondering, the other question we talked about in our prep call was about what gets you, what was your impetus, or what has gotten you excited to be doing what you're doing? Because I know it sounds like everyone here is very passionate about what they do, but maybe start with either Ashton, Karen, or Jordan, since you're in more of a direct service role. What keeps you going, and what kind of inspired you to get involved in what you're doing in the first place?
So like I said, I've been working in oncology for quite a long time. Complete career change from where I had been, and had lost a job and applying for anything that was available, and started in the billing office, just posting payments, handling appeals, and knew that I needed something more than that. So when the opportunity came along to move into the financial counselor role, I jumped on it. There's a lot of cancer in my family. And I've unfortunately have seen a lot of friends and neighbors of all ages that have been diagnosed with cancer. And it feels so good knowing that I can take what I know from work and be able to help my personal friends and family, and to be able to help patients who think that they can't have treatment because they can't afford the cost of it, help them find ways to be able to do that. It's the most rewarding thing in the world.
Thank you, Jordan. Anyone else?
So
Sure.
I got into patient advocacy. My educational background's in teaching, but I had a genetic condition that went misdiagnosed for 25 years. And it was my daughter that led us to get answers. And I remember how frustrated I was with the system and just being dismissed and gaslit for so many years. And now my biggest thing is validating patients I work with and really helping them understand that I believe them. I know their symptoms are real, and really pointing them towards the care that they need and doctors that will hear them out. And then when they start healing, and I know it's only taken him less than a year to get answers, it's really, it really motivates me to keep going.
So I'll just add that, I worked in the field before I got my degree in social work, and was I automatically gravitated towards case management and helping people access resources. I just found it a field that was rewarding. And a lot of times I find people are really overwhelmed with finding the resources they need to just live life, the best they can. So I just always really enjoy that aspect of social work, with connecting people with the needs. About 12 years ago, I became a caregiver for the first time in my life. And my younger son was diagnosed with type 1 diabetes. And I immediately became his advocate and learned how challenging, navigating healthcare with someone who is diabetic can be, and just the cost of medications, the cost of supplies, and then also seeing it in my work life, and just seeing that, really access to care can play a big role in patient outcomes, and how people are able to manage their diagnosis and condition. And it really keeps me going, just knowing that, the work we do can really make a difference in people's quality of life.
Beautifully said, all three of you. I think healthcare and this field is very personal for most, if not all of us. So we really appreciate you sharing your personal stories, because that is certainly a driver for a lot of the advocates on our call as well. And yes, a nugget from Ashton, validating patients. Thank you, Faye. And Michelle, I know your transition into this the financial health space, is relatively recent. So can you speak to a little bit about the interventions that your organization talks about to help tackle some of the challenges, and part of it is navigating the system, but affording the various components?
Absolutely. So let's start with medical debt as an example of how the healthcare system is disrupting someone's financial well-being. So we recently released a series of reports looking at medical debt as a national problem, but also what is it that healthcare stakeholders, specifically hospitals and health systems, insurers, and employers who sponsor insurance can do to prevent medical debt. Because the way we look at it and the way our research shows, people actually get medical debt by the way they experience the healthcare system. They have a need. It's and a lot of what they actually need, what they get medical debt for, really is for a one-time hospital stay or an unexpected medical expense. But a lot of people accrue medical debt because of those longitudinal healthcare needs they have when managing or dealing with a chronic illness, and their insurance system isn't always set up to allow them to utilize healthcare with minimal out-of-pocket expenses, unfortunately. In fact, 41% of people in this country have healthcare debt, and it's disproportionately affecting women, people of color, low income, chronically ill, and of course the uninsured. But we're actually seeing the insured increasingly taking on medical debt because of those out-of-pocket expenses they have through their plan. About a third of medical debt is for an expense under $1,000, but at the same time, a third of people can't manage an unexpected expense of $400. So it really is problematic. In our reports, we talk about the different recommendations and tactics those stakeholders can take. So obviously there are some changes in the benefits packages as well as charity care systems. We also talk about proactively identifying and supporting patients who are at risk of medical debt, and there's some data that can be used to do that. But one place where we lean in heavily, a third theme that we look at across all of our stakeholders, is helping consumers or patients make informed decisions. And having those cost of care conversations at the point of care with the patient is really critical. But so are financial navigation services. It really helps patients access the care they need, find ways to leverage or apply for public insurance programs or other charity care programs. And also there's a lot of price transparency that's out there now. Not all hospitals are doing it the same way, and not all insurers are doing it the same way, but they are required to do it. But that's not something consumers on their own can really use and make informed decisions. So having those financial navigation services or patient supports can really help them make the right decisions and access the care that works for them. And we've seen how those types of services really do improve access to care and improve health outcomes for patients. And if we're thinking a little bit more proactively, more upstream, what is it healthcare system can lean in on to be more proactive about financial health? There's a lot they can do. So if it needs navigation is really a broad service. We've talked about it. A lot of healthcare systems are also partnering with financial institutions for medical financial partnerships, which are working to reduce patient financial stress. They're often co-located. They provide a range of financial services, usually built on the foundation of financial coaching. Financial health is a very nuanced issue, as I talked a little bit about in my opening conversation, but having a needs navigator to actually work with the patient to help understand what those patients' real priorities and concerns are, and working with them to either address those or finding the right referral solutions for them is really critical in improving their access to care, their health outcomes, as well as their financial stress levels and their financial situations.
Right. And I think we see this also as an incredible opportunity to help decrease some of the disparities in health outcomes when you meet people where they are. So just going back to our other panelists as well, Michelle, you mentioned about, proactively supporting patients, and a lot of the interventions that you just mentioned are it's the bread and butter for the navigators here on the line as well. So I think Ashton, Karen, and Jordan, if any of you want to just share a little bit about, when you're helping patients and providing these services, who else is on your team, and how are you working with others in a interdisciplinary way to ultimately meet patients where they are?
So I refer patients out when I know that they can be better served elsewhere. Typically, when patients are not able to afford my services, I refer to Patient Advocate Foundation. They also have been my go-to for medical billing and insurance, because that's something I don't provide. I have a growing list of resources and programs and other board certified patient advocates that I often refer patients to, and not even my clients, just anybody that reaches out to me and I know that I can't help them in the ways they need help, or they just can be better served. And there is specialties and within board certified patient advocates, for instance, cancer, and it can even get more specific to like advocates that specialize in breast implant illness. So there's so many people out there that can really help a particular patient and with exactly what they need.
So I would say that when we're faced with a patient that has needs that we're not quite sure what to do, we actually have team meetings weekly to discuss, to see if, within our small team, if we can come up with some different ideas. I find that oftentimes thinking out of the box or just talking to people really can maybe help generate some different ideas that you wouldn't think of yourself. We also work hand in hand with many different community nonprofits, and then also, different clinics. And, I think it really, it's worth investing the time and making connections through meetings in the community, whatever kind of networking opportunities, or if you're going to an event, reaching out to all the other organizations that are at that event. A lot of times that's how you can make connections that really can make a difference in helping people navigate access to care.
We have a team of 10. 8 of us are focused on the patient assistance, insurance authorizations, and then 2 are focused on benefit verification, making sure patients are in network before they even hit our door, so we don't have any unexpected out of network expenses for patients. Just like Karen said, we meet twice a week for a quick huddle. Sometimes they're 15 minutes, sometimes they're 45 minutes. It just depends on what's all going on and what issues we might be running into, to brainstorm with each other, come up with ideas. It's not uncommon for us to be bouncing questions off each other all day long, sending emails out. ACCC has amazing discussion boards, one that's kind of all community, one that's focused on financial advocacy. It's great to throw questions out on there and see what people are doing across the country. Have they run into this issue? If they have, how they've resolved it. If it's not something that we feel that we can help the patient with, like I said, we work closely with our social workers in the clinic. So maybe it's something that they can help them with. The hospital system that we're aligned with has a group that they're contracted with that will help screen patients for Medicaid eligibility, help them with that application. We have resources to direct patients to who need help with Medicare coverage. What's the best coverage, comparing different plans, same for marketplace plans. So it's great to have a big network of people. We have contacts within the hospital's billing department that can help us if we're not understanding why something's being denied, so that we can appeal and get it covered for a patient.
Yeah, I think there's a clear theme there around thinking creatively outside the box and really leaning on colleagues in various areas and other organizations to think about how to creatively solve these problems. And I imagine also to maintain, resilience, because I know it can be very challenging to feel like, you're the person that has to solve it all. But I think what we've heard from the patient perspective is that having like a person to help them, dedicated to helping them through makes a huge difference in, going through the entire care experience. So I think the other piece that we talked about a little bit earlier around, and I saw a question come in through the chat and I want to address it now because someone asked about whether or not, how do patients find these navigators if it's not through, a provider or an employer. And I think that's part of the problem, right? It's that you all are doing this extremely valuable and important work in various places, in various care settings, but it does not seem, that patients are always aware that it's happening. Any comments on, how, I guess it sounds like, you may be referred or patients may be referred to you from other providers, but I guess anything else you'd like to add on that?
I would just like to say that I know that there's an initiative right now, Greater National Advocates, that you can search for providers. And there's also places like Alliance for Professional Health Advocates. They have a referral list. I just am not sure how it goes to, like, the Patient Advocate Certification Board. You could go on there and search for patient advocates, but it's kind of hit or miss trying to let everyone know where these resources are.
Yeah, I think that also speaks to the need for the field to continue to come together and build on the models that exist to make these services as widely available and readily accessible as possible.
So in our cancer center, our financial counselors, we meet with our new patients. The goal is to meet with them at their initial consults, even if it's a quick, hi, I'm here to help. Here's my card. Call me if you've got questions, because we know they get a lot of information up front, but we also know that a lot of their concern is financial. And so we want them to know we're here to help them out, explain what we do, give them a sheet that explains their insurance in layman terms. And we find that by doing that, that it helps ease a level of anxiety and take that worry and, push it off to the side of the plate so that they can focus on their health, which is the most important thing.
I think sometimes people don't realize that their insurance company might also be a resource. If people are insured, a lot of times they do have like a nurse manager or some type of case manager that will help them navigate if they're getting into issues with affording, care or getting resources. I know when I recently had an injury, I had someone that called me immediately. And a lot of times people don't know even what's available to them from what they have. So sometimes, it might just be, them calling their insurance company and saying, are there any services you can offer to support? That's if someone's insured, right? So if they're not insured, then, it's really helping them navigate the resources in their community. I think a lot of people don't even really understand that there is this huge network of services available if you're uninsured, and people just assume they need to pay out of pocket. And it's a gap that we really need to address. If people are uninsured, how do we help them navigate?
There's a lot of programs available, but they don't make them easy for the general public to know about. So,
right.
Well, it sounds like that the question posed is a really good one, and one that, together we can help identify ways to get that word out. But building this as a standard of care, I think, is probably one of the only ways that it will become normalized. So it's good to hear that there's a lot of promising avenues out there, but making that part of the standard would be hopefully the silver bullet we're looking for. But to that end, thinking about like the broader public health approach to normalize these financial and social services requires a few things. So I think you all mentioned, networks of people focused on meeting patients and caregivers' needs in all settings. And then the other piece is investment from health systems, employers, government, and health plans to really make social determinants of health screening and a standard part of care again. But in addition to the screening, the referral piece is the intervention that will help connect people who have these various needs to supports that will help address them. I don't know, Michelle, I think you talked a little bit previously about social determinants of health screening and the fact that there is momentum building in this area. So how can we build off of that to make navigation services more widely available?
Sure, I have a couple thoughts on that. One is if, they go into the concept of that public health approach, it is an opportunity to leverage existing screening, but we're not always screening for the right things, right? And so screening is really helpful from a clinical perspective and from identifying what types of services or referrals a patient may need, but it's really a conversation starter to work with that patient to understand the nuances and the preferences that patient may have. That patient may need, you may think that patient may need to deal with a transportation barrier, but they're really concerned about their ability to pay for food that night for dinner. It really needs to be a conversation with that patient. And also when we're thinking about leveraging our existing SDOH screening, it really is an opportunity to test our previously defined notions of why we're using this information. What are the use cases for this data? Is this screening and this work really helpful for us to wrap our heads around the full range of what that patient may need? If we're thinking about medical debt, for example, do we have the information we need, not just to help navigate a patient through an enrollment process and charity care, but then do we still know whether or not this patient may be at risk for higher, more out-of-pocket expenses? So let me rephrase that. Is this are we going to be able to enroll this person in insurance, but then are we going to be able to manage the out-of-pocket expenses, or should we be working with the hospital system to make sure that patient is eligible and receiving reduced cost care or a special financing program to meet that? And screening doesn't do that yet. We also need to think about screening as a way not just to have that conversation, but again, to really think about how screening can help build relationships, or how we can actually use that process of understanding needs to build relationships and trust and identify the priorities. I've talked to community health workers, for example, who had to do a lot of work to read between the lines to figure out what that patient really wanted to do or what that patient really needed before they would even come into the door of the health center for care. And one case, a community health worker told me that that person was too afraid to leave the house for a variety of fears and concerns that patient had. And also that patient didn't have a way to clean their clothes and needed just a simple washer, dryer, or some access to a laundry mat so they felt comfortable enough coming out of their house. And so that's really all I really want to say about screening, but I did want to go back to the referral point. Referrals are a really, really critical piece of the needs navigation and addressing the patient's full range of care needs in order to improve outcomes and improve access to care. But I love the idea of that needs Navigator as a linchpin, because from a clinical workflow perspective, you have all these systems that healthcare systems are using to do online referrals. Like, oh, this patient said they have a food insecurity. I'm going to go into my Unite Us, Aunt Bertha, or other systems, which are very, very valuable resources, and identify a food food bank or some other service. But from a patient experience perspective, having somebody, and from a workflow perspective, having somebody there to help connect the dots on that patient journey from going from their clinical care and all those things they need to make sure they can maximize, they fully attain their clinical needs. And also for identifying the gaps at the community level and figuring out how we at the community level can really close those gaps in social needs and financial wellness needs.
Yeah, and it sounds like, Ashton, Karen, and Jordan both gave really good examples of how they do exactly that in their day-to-day. So believe it or not, it's already almost 12:50. So I think we will open up for a few questions from the audience before wrapping. And, any of our speakers are welcome to chime in if there's anything additional they'd like to add. But Melissa, is there, do we have some questions from the chat? Let's see.
We do have some questions, and I see Jordan has actually been trying her best to answer some questions as well. There was a question that, let me see here. I think Tanya asked that I was wondering if either Karen or Ashton could also speak to. The question is, how often do you partner with pharmaceutical companies' field reimbursement managers, and do you find value with them?
I guess I can just go real quick. As a board certified patient advocate, I represent the patient solely. So we don't really partner with other, I'm trying to think how, we're independent from insurance. And that's just so that we're not biased to insurance or the health advocates, patient advocates at the hospital. We are solely hired for the patient. So that's where it comes in that we aren't reimbursed and we stay independent from that. I know we get a lot of questions on why we don't take insurance or work with insurance companies, and that's the reason.
I think Rebecca has her hand raised. If you want to chime in, Rebecca.
So glad, Ashton, that question came up, but Ashton's response to I'm Rebecca Kirch from the National Patient Advocate Foundation. Thank you to all the panelists and the team for putting this together. I'm so struck by the unifying forces that you've all talked about as themes. And one of them that Ashton just hit on is the role that insurance companies have or don't have in this space. And some of you have touched on a little bit, but one sort of sticky wicket that I'd love to hear your response to is concerns that if insurance companies are driving these services instead of all of you in your fields, what could that mean for patients in terms of trust, but also outcomes? You all talked about health outcomes. So elaborating a little on the focus of the health outcomes and your focus there, I think would be really helpful, because what I want to make sure that the navigation field collectively as a strong force does is a force focused on patient needs rather than cynically speaking, for example, bottom lines of health systems or insurance companies, right? I think we all can kind of coalesce around the importance of that. But can you share your perspective around the outcomes that are the focus for you that would resonate for your colleagues, but also for patients? Because we all use that word, but what does it really mean for each of you in terms of what you're trying to drive here that I think is common language for us to be thinking about?
I'm sorry, you can go.
Oh, sorry. I think, you kind of touched on it. Like, we're financial navigators helping the patients ensure that they have insurance coverage and authorizations and have assistance for the treatment that they need, that they have access to the treatment that they need. But I think what goes along with that, and especially the insurance coverage and authorization part, I mean, I want to say that we're solely focused on the patient and making sure the patient gets what they need. But hand in hand, we're also making sure that we're getting the reimbursement that we need from the insurance companies as well, and that we're holding the insurance companies accountable for what they say that they cover and making sure that they're doing what they need to do so that the patient can get the care. So as much as I want to say it's all about the patient, it's only the patient, they go hand in hand, because we need insurance to do what they need to do, what they say they do, what they have authorized to do, so that the patient can get it, but also so that, you know, on both sides of the fence, you know, things are taken care of financially. And I think, yeah, insurance companies have case managers, you know, that can help patients through things. From my experience, it's great to have them as a resource, a direct contact person when a patient needs authorization on something, especially when it needs to happen, you know, quickly, and we don't have to go through 400 automated systems and fax something in. We can go right to the person and get a response quickly. But I think, yes, they're there to help the patient kind of navigate through appointments at 3 different doctor's offices across 2 different health systems in 2 different cities. But I think, and ultimately, is the insurance company. So I think they're great and they're helpful, but I think ultimately they're there for the insurance company, not necessarily specifically for the patient.
Okay. So I think we might have time for one last question. And we can do our best, you know, to follow up with folks. But we are running a little bit out of time. Melissa, anything you wanted to flag?
Yes, I think this one question from Allison, I think kind of is a good follow-up to the question that Rebecca just posed. She asked, what resources would be suggested to measure impact on health outcomes? And Allison, you are welcome to go off mute if you'd like to sort of elaborate more. And if you wanted to specify the question to any one of our particular panelists, you are welcome to do that too.
Sure. My name's Allison. I'm with the National MS Society, and I'm not sure who to pose the question to, but just curious. You know, I'm hearing, you know, the need to tie this work back to impact on health outcomes. We have a large MS Navigator team, and just looking for insight, resources, connections to tie our navigation work back to impact on health outcomes to see what our impact is. So any resources around that would be welcome.
Oh, you're on mute, Karen.
I mean, one thing to maybe look at that you maybe have more control over than other things, since you're not the insurer, is maybe patient experience and measuring, you know, their experience with care, maybe before the navigation and after the navigation. Patient experience is a tool that I think a lot of organizations use to, you know, look at things in a maybe a little different way than traditionally. But Michelle might have some thoughts on this as well.
Yeah, it obviously depends on the type of data and the type of system that you're working with, right? Because it depends on, you know, what types of claims or what types of practice management data you have. But I'm thinking it could really range. It could range to, you know, access measures. Were there fewer no-shows? Was there higher utilization? From a business case perspective, from the institution, were collections higher when people actually had a better way to understand and plan for and find ways to reduce out-of-pocket spending? Did outcomes change? So I'm multitasking a little bit right now. There's a study I'm looking for to put in the chat that actually had some great outcomes measures of a financial navigation system.
Yeah, and I think there's something to be said about, the lack of data around, beyond financial navigation or specifically financial navigation in the oncology setting. I think there's, data lacking around like the broader navigation field that includes all of the things that we just talked about today in terms of navigating enrollment. And so a combination of all of those things. But Michelle, thank you for sharing those points. And if you find the study, please feel free to put it in the chat. But I think we are probably out of time on answering questions, but I just have a couple of additional slides to share with you. Let me just get this in a better format.
While you're doing that, Nicole, I didn't find the link, but I found our report that talks about the study. So I didn't get a chance to put the links into our reports on medical debt. And in the report for hospitals and health systems in particular, we actually do talk a lot about other care team members' role around informed decision-making and supporting patients in that process. And we talk a lot about care navigation or financial navigation. And within that, I believe you'll find that study. So I'll just plot that in.
Thanks, Michelle. So I think at the end of the day, what we heard here today and what we at NPAF are extremely excited about is that every one of you contribute key aspects of what patients need, of what quality needs navigation could be. A few conclusions that we've derived from our conversations with patient groups thus far, community health workers, and others in the field is that in addition to a pretty comprehensive literature analysis that we just recently completed with help from our two summer interns, navigation is a broad field that encompasses clinical, financial, and social services. You all touched on various aspects of that. But I think the key thing I wanted to emphasize here was that we have so many characteristics in common that unify the field in terms of the way that we refer out and the resources that we use to point people to. But that consistent definitions and descriptions can only advance our shared goals to connect more people with the resources that they need to get the healthcare that they need. And finally, this whole process, and in our panelists' remarks, they emphasize the adaptability, flexibility, and creativity as crucial components to address what patients need. And I think we see this, in our experiences as patients as well. So, final thoughts here. Together, we do have this incredible opportunity to make needs navigation a standard of care. And I think that certainly involves, convening again for following meetings as well to talk about, again, what are those outcomes that matter to patients beyond, in addition to resource utilization and some of the things that Michelle talked about. But what are these outcomes that matter most to patients, and how can we craft needs navigation programs that measure what patients want? And so we have a few action steps for you all on the call today. If you are an individual, or organization, we welcome you to sign up as an allied partner on our email listserv to receive updates on this health needs navigation campaign. So this will come through in a follow-up email to you all tomorrow. In addition, if you are an organization or represent an organization, we invite you to sign on to our needs navigation statement of principles. There are 10 of them, but they certainly touch on a lot of the remarks made today. And finally, please plan to attend our next webinar, which is scheduled for September 13th at 12 noon Eastern. In keeping with the theme of unifying this incredible field, this next webinar is focused on the common grounds in finding common ground in navigation policy pathways. And so, this is our policy focused webinar. We welcome everyone who's here to join that, and also share with your policy colleagues to join our NPAF and PAF CEO Alan Balch will be joining for that as a speaker, as well as Becky Ship, who is working with NPAF and my team, and she is a valuable asset as a former Senate Finance Committee staffer. So we'll talk about some of the legislative and other pathways for making needs navigation readily accessible as part of the standard of care, or as a standard of care. And with that, we thank you so much for your attention, and we appreciate your feedback and welcome you to join our initiative and complete the evaluation at the end of this webinar. And if any, Rebecca, if you had any final thoughts to add, please go ahead.
Thank you to all the participants and my incredible team for producing this webinar today. We unfortunately had an unexpected cap on the number of people who could tune in. So we will be fixing that glitch for our next webinar so that it can allow more than 100. We had over 400 registrants. So we know people, this is an area that resonates with the field, and we're excited about that. And thrilled to have you all here today and look forward to our work together. So gratitude to everyone who tuned in and to this incredible team for putting together the conversation and our panelists. Thank you. Thank you.
Thank you all. Have a good one.
Well done, Rebecca. Well done.